Join us, the Humanitarian Heartbeat Podcast, on a journey where we delve into the heart of the matters that truly make a difference. Our mission is to create a platform where we can openly discuss topics that often go unnoticed or unexplored. We aim to shed light on these crucial issues and have meaningful conversations. We invite you to tune into our podcast, where we will explore the depths of these subjects and let our hearts guide the conversation. Together, we can create a space where everyone's voice is heard and where we can collectively work towards a better future. Welcome, everyone, to the Humanitarian Heartbeat Podcast. I'm your host, Nia Imani, and I have the pleasure of interviewing this beautiful lady. It's audio only. If only you could see her beautiful face. You're going to see her picture, though. Miss Erin, thank you so much for joining us.
Thank you for having me here. I'm so excited to actually be able to do this finally.
Thank you. You guys, she is amazing. We're going to learn something new about a specific gene. So we're just going to dive right into it and talk about the importance of just knowing your family history and so many other things. Erin is the founder of HATTR Next Gen, a movement dedicated to raising awareness about V122I, hereditary amyloidosis. How do you say that?
Hey, you did good.
Okay. A condition that disproportionately affects the Black community, another one. Inspired by her late father's battle with the disease, Erin's mission focuses on improving equity in healthcare by engaging younger generations in the conversation around early diagnosis, access to care, and education through social media platforms. With nearly 25 years of experience, and if you're going to see that she looks like she's 28. So how is that possible? Okay. With nearly 25 years of experience in clinical research, laboratory oversight, and regulatory management, Erin serves as a senior manager of education and awareness at the, Lord help me right now, Amyloidosis Research Consortium.
You got it right again.
Where she continues to lead educational initiatives and outreach efforts aimed at improving patient outcomes. Her work is a testament to her passion for health equity, patient advocacy, and bridging gaps in care for underserved populations. Erin, tell us about your dad's diagnosis.
Sure. So yeah, I think first and foremost, I think what people need to know about me is I'm a daddy's girl. So in 2014, when your dad's your hero and you find out your dad is sick, that's a tough one to take. And it started with dad just, he was bloated. He had a pneumonia. He had what we thought was a heart attack. He had been to a couple of regional doctors, and nobody could really figure it out. And this was a man, athletic guy, his whole life, like a star football player, an athlete, like still ran miles a day. I used to joke with people like my dad's running was like a sprint and I could never keep up with him. So when I tell you like shortness of breath and having all these symptoms, it wasn't like dad. And so finally, because he wasn't getting better, we had taken him to a regional doctor that was very good for their cardiac care. Actually ended up being lucky for us that did echo on my father and said, I think I know what your father has, but I can't treat it here. And we're going to have him go up to Boston Medical Center. And honestly, that original doctor's decision gave my father 6 years. But when he was worked up by Boston Medical in that 3-day period of time, he was genetically tested and found out that he had what is called V122I, amyloidosis. And that's a hereditary form of amyloidosis. And just to give people a very like lay overview of what that means. So amyloidosis, actually, there's many types of amyloidosis that are out there. And what we're specifically talking about is transthyretin. So that's what the ATTR stands for, and the hereditary variation. And so basically all that is a lot of language that says you have a protein in your body, a TTR protein that exists in your body naturally, and it is needed as part of your functioning. However, in the case of dad, it starts to mutate or change, and that change causes the protein to actually build up or kind of clump in various parts of the body. And in this case, specifically to V122I, that causes the heart to malfunction. It causes a cardiomyopathy, so it causes a restrictive heart. So it's that stiffening until eventually it doesn't work anymore. And during my father's time, between 2014 and 2020, there wasn't a whole lot of medication available for him. He was put on diffusimal for the majority of his illness, and diffusimal is an NSAID. So, like, I'm sure like and not ibuprofen, but that type of medication. And it's actually marketed for like arthritis, but they found as like a secondary finding that off-label use, it has helped folks with amyloidosis. So from about 2014 to 2018, that's what he took, and it kind of kept him stable. And then in the latter part of his illness, we had tafamidis come to market, which a lot of folks nowadays that are being diagnosed, that's what they're put on as a stabilizer. And that's what he took until his death. Unfortunately for dad, by the time they even got to see him, he already had moderate disease. So the unfortunate part of that drug, as I said, it's a stabilizer. So once that disease is already, when that misfunctioning is already happening in the heart, you at the time were not going to be able to reverse any of that. Basically, it was just going to keep it from getting worse. So his disease was still going to progress. And I lost dad May 4th, 2020.
Wow.
Yeah.
How was that not only losing your hero, but losing him during the pandemic?
Challenge. Dad at that, when you talk about end stages for anybody going through anything, it is a tough, and then COVID just added a different layer, because if you could recall at that time, we weren't allowed to have large gatherings, right? So dad went into the hospital because he was having heart, but he was also in kidney failure. But he was put on the cardiac unit, and unfortunately what was happening with him is when his, they would treat the kidneys, the heart would fail, treat the heart, the kidney would fail. So he was just at that point where nothing was happening. He was alone. He was alone. And I, with my family, had to sit mom down and say, I think it's time, and do it. This is the choices we have. If we leave dad where he is, he's gonna die alone. Or we make the choice to bring him home and have hospice care. And I, to this day, I'm glad that I did that for my father's sake. But it was challenging. And then after that, like you said, then you're talking about the services and all of that. Dad was a private man, so I think it was okay. But I don't know that it was okay with the family, because I know that all the people that might have grieved my father did not get to grieve him properly. And to this day, there hasn't been a memorial service and a gathering in that way. So I think for some people, there probably wasn't the closure that needed to happen.
Wow.
Yeah. But for my sake, I mean, of course, and I think I wouldn't do what I do if I didn't grieve the loss of my dad and have to turn that into something else. But I also got to the point with anybody, they think that's dealing with chronic illness.
Mhm.
Dad was so sick and he was really failing. And I have to try to look at it as he's not suffering anymore.
Right. Did so you mentioned you had that conversation with mom. Did you have that conversation with dad?
So dad at that time, he was kind of in and out of being able to really function for himself.
Mm.
But it's one of those things that you kind of just know. You know your parent and you know what they wanted. And dad was holding on to be home.
Yeah.
I honestly think if I look back on it, so as I said to you, dad died May 4th. Dad and I have a birthday in March 21st and 22nd. We always celebrated birthdays together. I
Mm.
remember at that time, dad said he was really wanting everybody to get together. And to this day, this is a hard thing for me just talking to you about it because it didn't go the way I would have hoped looking back. But we were trying to keep dad safe, so we didn't have that birthday party for him.
Understood.
So I think he knew. I think he really knew that his days were numbered.
Mhm.
And so that by the time May came around, even if nobody actually verbally said the words, he knew it was his time.
Mm.
And then his final days, honestly, when we brought him home and stopped his regular medications, and then he was put on, just care for pain and things like that, he was mostly sleeping. He was mostly sleeping. So I know, and we were all with him when he drew his last breath, which I think is what he would have wanted, and he was at peace.
Yeah.
And that's really important to me. I think it's one of those things that everybody says, I want to be there when the person I love dies. It's a hard thing, but I think the thing is you have to make the decision for yourself. It's like what would be best for the person that is leaving this world. But it is a memory, I have to tell you, that I work very hard not to have as the last memory of dad.
Yeah. I understand that. I do. I do. I'm sorry you had to go through that. I'm sorry your mom and your family had to go through that.
Yeah, but half the reason like why we're here today and I'm talking, it's interesting, and I guess we'll talk about my own personal journey with this disease in a second, but um I remember just when my journey started with this, Dr. Burke had said to me, that was one of my father's doctors, that now is one of my doctors, said, Erin, your father may have given you a hereditary disease, but he also gave you a map that he didn't have. And I look at that and I don't like the fact that my father had to suffer. I don't like the fact that he didn't have the knowledge of this illness. However, if losing my dad means I'm saving somebody else's dad or mom, then I know dad would be okay with that.
Yeah,
Yeah.
I understand that.
Yeah.
So let's talk about that. So
Mhm.
dad passes away. How did Dr. Burke become your doctor? How did that transition happen
So,
to
like my journey to dad's journey, from dad's journey,
correct?
let me take a step back and say to you, when dad was diagnosed in 2014, we were advised to have genetic testing, his children. Um, at that time, and it's funny because I've been in and around the healthcare world for a long time, worked in research. Yeah, sometimes you think, okay, because I'm in this setting, I'm going to use that headspace when things like that go on in your family. But you don't. Sometimes emotion trumps over everything. And so, what I heard when dad told me he was sick, well, all energy went towards um, one, dad. Two, I also heard, well, it happens usually in like, sixth, seventh decade, primarily in men.
Mm.
And at that time, I received that as, oh, men, I'm a woman. I don't need to worry about that. I am in my 40s. It will be fine. If I have to worry about it, I'll worry about it later. And compounding that also was I worked, as I said, in the clinical research space, and I worked in Alzheimer's disease.
Mm.
So whether, even though it's not exactly the same, Alzheimer's disease is also an amyloid process um,
Hmm.
with the brain. And that's why I kind of had some understanding when my father had a diagnosis. But the sad thing about that, Nia, is that I was doing a lot of coordination work then. So I was heavily involved with the weekly care of folks that were coming in for research trials. And one specific trial was called the Diane trial, or the dominantly inherited Alzheimer's um, disease.
Mhm.
So these are folks that they have a genetic mutation related to having an Alzheimer's disease. And so therefore they have an early onset Alzheimer's disease. And we're talking about people that are 30s, 40s, 50s years old.
Oh.
And when at the time that I was seeing them, things have improved for Alzheimer's disease in recent years. But at the time that I was seeing them, they were being primarily observed. There was not a lot of treatment that was being done. And I saw the anxiety that some of these young people had. And so in my headspace, looking at what my family was standing to go through, I said, I don't know if I'm ready to carry that weight,
Mhm.
not knowing that there's anything on the horizon to help me. And that, truthfully, that went from 2014 to the time my dad passed. I remember asking the director over at BNC, I said, what's changed? What's the research like? And I said, are there prodromal studies? Are we looking at that right now? And I remember one of the physicians saying, Erin, your mind's ahead of where we're at with the science. So I said, okay. So I kind of went away from that for a while, and you just live your life. And as you recall, we're living our life through COVID. So I don't think it was the highest of priority for me
Mhm.
at that particular time. But then it came to 2022. I started to have a bit of a back problem. Like my back was hurting. But I was on my feet a lot for work and things. And then like my right lower leg was hurting. My wrist would hurt. My right toe would hurt. And like feel numb and just like strange sensations. And the best I can explain to you is I was thinking that I had like a clot in my
Mm.
leg. I actually had gone to the ER a couple of times because I wanted to scan because I'm like, this feels weird and I don't know why. And it kept happening. Um and I also had like a car accident, but the car accident had happened like prior to that. So then I kind of was like, oh well, maybe it was just a little bit of a tweak, and then maybe the accident just made it worse. But then, 'cause I think I was kind of trying to explain certain things away, and then it got towards the ends of 2022, and I'm like, I know enough to know that numbness and certain things, I probably should talk to my father's doctors about it. And so I called them up and I talked to Dr. Burke and explained what was going on. And the immediate first question he asked me, he says, have you got your testing done? And I said, no. And he said, well, Erin, we saw your dad in his 60s,
Mm.
but his predicted age of onset. So their best guess by his reported history to them would be that he was probably likely symptomatic in his early 50s. So, at the time I'm 49, I was 47-ish at the time.
Mhm.
And so I was like, so they basically said to me, you are in that kind of sweet spot that you probably should do this.
Mhm.
And at the time, I was fortunate that Ambry, they were doing a program, and I could not tell you who was sponsoring it at the time, but they had this great program where you could do this no cost genetic testing with genetic counseling, which I think is very important, pre and post. And so I was able to, and it was do a very, very convenient where you were hooked up with a genetic counselor telehealth, and then you could order the kit, all very autonomous if you want to. And I, jack of all trades, master of none. I also worked in a lab for a while, so I was very confident that I could fill out my own paperwork. And I was probably a little bit OCD about it. Like, I'm doing this, like making sure that everything's packaged properly, and then I'll send it off to my PCP. I'll make an appointment and have them sign off on it, which that's another story. Um, so I had that done. It was a little bit of a rigmarole between PCP getting my results back, but right before the Christmas holiday in 2022, she called me and said, you know, Erin, unfortunately, you also are positive and have this genetic mutation B122I, and this is important for later in our story. And good thing you advocated for yourself. And so, of course, I got off the phone with her. I thanked her, got off the phone with her, and I said, you know, to myself, oh man, I am 40 something years old. Is this going to be 6 years for me like it was for my dad? Um, what's going to happen? And then honestly, you know, the rest of it was like really a whirlwind. I had to call dad's doctors back up, get all my records, and prepare for my first annual appointment with BMC, and that was in January, I believe, January, February 2023. 3-day evaluation, and you talk about everything under the sun being done, and the verdict for that. I should take a step back. It was interesting being there because when I talked to the genetics counselor, she had said to me, you know, Erin, I know you're anxious about this, but she says, I've been in this field for 20 years and I've been waiting to see people your age.
Mm.
I usually see people a lot older. And so I sat in the waiting room waiting for my appointment. I looked around me and boy, was she correct. Most of the folks there were older. And I'm sitting there thinking, well, why am I here? What's going to happen to me? I remember a gentleman looking at me, didn't even say much. And he has a different form of, he was active disease. I learned that later, but different form. And he looked at me and he just said, I just want you to know I've been coming here for 15 years. And I think that's all I needed to hear to kind of like, okay, Erin, you're going to pull through this. So I went through my 3 days of testing. The outcome of that, whew, basically, most standard tests that we have right now are not sensitive enough to say that I have amyloidosis. Okay. But what happened is I have a blood level. It's called a prealbumin level, has to do with the protein in your body. It's very low, and they could not determine why it's so low. They said, you know, a lot of times that it's for B122I carriers. This is what it is. It's on the low end of normal. Sometimes for malnourishment, but they said you don't look malnourished. So we're going to run more tests, which lasted for a good part of 2023. To see if we find anything else, because I also had an abnormal neuro, but just enough abnormal neuro because of the things I'm telling you about my hands and feet. Like I had these cold and hot, like sensitivities not responding the way I should. And so very inconclusive. Came around to my second visit with them in 2024, where my neuro exam, actually my health probably had deteriorated a little bit more. Like my neuro was still not great, and my prealbumin levels still not great. My mental health, not great. Everything was just not a good year. And they decided that year we're going to put you on diffusinol. Erin. We're going to put you on diffusinol, same med as my dad. And we're going to call it suspicion of amyloidosis because you're in this gray area where she says we don't have enough research that supports what it does in soft tissues of people your age. Right. And she says, I don't want to look at you in a decade or more and say, Erin, I should have been more aggressive with what I could do. The challenging thing for me right now, or just in general for people like me, is there are a lot of great drugs that have come to market for this type of amyloidosis since dad's passing, so in the last several years. However, and this is a big however, not for people like me.
Hmm.
because most of them are going to market for people that have cardiomyopathy or peripheral neuropathy. And thank goodness right now I have neither diagnosable. But that also means I'm kind of a sitting duck
Yeah.
in certain ways with an uncertain future. But I would say the good news of that is in March of this year, I had my third annual appointment with Boston. The great thing is that my prealbumin level came up to a normal range. My neuro is still not exactly normal, but it's stable. So why they can't definitely say why that is, they also have said, if we're starting to, if there's some pathology happening that we're just not able to detect, the hope is that diffusinol is stabilizing it, and hopefully will stabilize it for a long time. So that's my the story of, you know, dad's dad's journey and my journey. Uh, yeah, but within that, there's a lot of gaps, I guess, as to why and things and challenges that came across as
Yeah.
to why I had to start the hashtag.
Yes. Yes. Talk about that because you mentioned advocacy and sort of that law between your PCP, and talk to us about that.
Yeah, so I'd love to say to you that it was a perfect journey. And you would think with it would be with me having a first degree relative that was sick. I When I look back on dad's journey, it wasn't ideal, but when I now that I work in this field, I see that I've met folks that it's been taking 10, 11 years for diagnosis. So for dad to only been a number of months, even though he was so sick, I think he was on the better end of things. For me, the first thing that the doctor told me, dad's doctor said to me, was like, Erin, I need you to ask your primary care physician. It'll be good for you to have a baseline prealbumin level.
Okay.
And I said, okay, I'm going to be going to for a regular visit anyway, and we'll talk about that, and we'll talk about getting the genetic testing. I went there, Nia. Oh boy, it was not a good experience. She was like, why do you need that? And so I had to kind of reiterate, and I said, I'm happy to connect you with my father's doctors, explained my father's illness again, didn't order it. So, okay, fine. Now I'm going to get into um, the genetic testing piece. And as I told you, because now that after that's happening, I'm like, okay, now you understand why I'm saying I'm taking care of this 100% myself. I am making sure that it's packaged correctly. I have completed the process for this genetic testing correctly. All I want to do is make an appointment so you can sign off on it for me. And so and even that appointment was a rigmarole to get in. I had all the paperwork filled out. I said, I just need you to sign so that I can have this test. And again, a lot of dragging feet. And then they said, "Oh, do you want us to mail it for you?" I said, "Absolutely not. I will. I will take care of it myself." Um, did that. I was calling the lab because they tell you kind of when you read the process, they tell you about approximately how long it would take. And I knew I was right around the Christmas holiday, so I should plan for it being on the longer end of things. But I called over to the lab and they can't result out to you. But they said, Erin, we've processed and we've sent this to your PCP. We know your results. If you do end up having trouble getting it and you've tried unsuccessfully a couple of times, then let us know. We'll try to work it out for you. So it wasn't an Ambry issue. The woman was looking right at my results. Called several times to the PCP office. We don't have it. We don't whatever. And it was really me pulling teeth. The whole I'm really paraphrasing here, but this is like over a month's worth of process that I'm telling you in a very condensed amount of time. And so it really burned me inside when I got that phone call that said, Erin, you're a V122I, and then the insult to injury being, good thing you advocated for yourself. And yeah. And so I said to myself, yeah, it is a good thing because how many people would have quit when you said no the first time, even with a first degree relative? And if they don't have a first degree relative and they only have symptoms and they're saying to you, oh, their body's not working correctly, and you tell them no, how many of them are actually going to keep pushing? And had I not pushed, yeah, I would not be on my third year and not be being treated with difenysanol. And so at that moment, I said, no, there's problems grassroots, there's problems grass tops with this illness. And so I said to myself, I that's how my hashtag was formed. It wasn't fully formed plan, but I was like, no, I want a social media movement that is going to create awareness in these spaces. And simultaneously, I happened to be looking for work and was starting to network through LinkedIn. And this is how I met folks. I kind of peripherally knew about the consortium because since being a carrier and all of that, I started to get their newsletter, their email newsletter, but started networking with them, and I was able to get the job as their senior manager of education awareness. And that whole premise of that is I wanted to basically kind of marry both of my professional life and my personal life. So my personal life deals a lot with the community, and trying to increase knowledge and awareness in those spaces. And my professional life is within the healthcare community and healthcare systems and providers to provide awareness in that spaces. And really, the goal is not to be an alarmist, but to empower people with knowledge so that they can make the appropriate decisions for themselves and feel like on both ends of the spectrum. So the doctor can feel confident in the office that what they're seeing could potentially be related to amyloidosis, and the patient can feel empowered to say, these are my symptoms. Can we explore that?
Right, right. Now, I feel like I have a two-part question. My first question is, and I feel like others may have that question, why couldn't, and this happens all the time, why couldn't dad's physician sign off? Why did it have to be your primary care doctor?
That had to do it
Yeah.
because at the time, and I do think that's a process that could be improved, but at the time I was not a patient of that center. And I do think, I can't speak for all centers, but I do across the United States, but I
Uh-huh.
do believe most of them would probably be along the lines of this. And it's because I am not a patient. And then if you think about the amount of testing that I had to have, they don't want to do that on somebody that is not a carrier. That would be like the type of scanning and things that I was required to have would be a huge expense. So it's best to probably it makes most sense to probably go through the person that knows you. And ironically, so I'm one of four, and I neglected to say earlier when we talked about the amyloidosis and overview hereditary form,
Mhm.
and we can get into that a little bit why I care about it so much for the Black community, but it's what they call autosomal dominant. So meaning 50% chance that you pass this down to your relative. So I'm one of four. My older brother and my baby sister have not been tested. My the she's a bit younger than me, 8 years younger than my younger sister. She has been tested and she is negative. But when I listened to her story, and she had even more, she had probably months of a back and forth with her PCP before there was a sign off for her to be tested. So that indicated to me that this is not an isolated incident. This is a systemic issue that we need to address.
And let's talk about that. Why is it so darn hard? I don't feel well, or my first degree relative has this. Just order the damn test. What's the issue? Do you know that? Can you talk to us about that?
I wish I knew all the issues. When I thought about, I mean, one, I'm actually talking to another young lady right now who her primary care physician is wonderful. looks in the chart, listens to her, and is moving it forward. And there are others that are not. So I think one of the issues, just overarching, and this just is not amyloidosis specific, is doctors remembering to be active listeners and to not and to be okay with, just because, like when we talk about rare disease and it being a zebra, just because it could be this other, it looks like that's the most obvious thing, doesn't mean it is. So let's not forget our investigative skills. And so I think that's one problem. The other, I think sometimes when in the case of like genetic testing and things like that, I almost feel like there's a concern from ordering and putting their name on a test that they don't really have any understanding about. So I think that, like, they worry about their licensing, their, ramifications for signing off on something or order something. So I do think that more education has to happen in that space around what this means for them, and that is okay. And that has been addressed to a point. I think you have some pharma companies out there now, like Alnylam and what's the other one there? They're doing, I think it's AstraZeneca. They're doing a couple of programs that do the free genetic testing. So I do think that they have a very good system where they are very familiar. Their labs are very familiar with the process for amyloid, and they're able to communicate well to providers. So it kind of mitigates some of that. But again, that it's not like standard of care, right? So it's like, it's not like ordering a CBC, which everybody knows about. So there's a comfort level with certain things. But yeah, it's a multifaceted problem. And then the other part of it, even if you do have a good provider, I think the other half, like we spoke to briefly, was advocating for yourself in terms of, like, when you go into the doctor's office, it's okay to say, like, nope, this needs to be done, and to push it. Even if your doctor is saying, no, I don't think so, well, then I like a second opinion type of thing.
Right. It's just, and so those who are listening and what you've described, they're saying, I feel this. Is there
Mm-hmm.
a certain type of genetic testing you have to ask for? I feel like when people hear genetic testing, they only think of, and this is myself too, BRCA1, BRCA2, right?
Mm-hmm.
So what do I have to ask for? What verbiage do I need to
So
say?
right now with a Nylum, or I should say, you go to a doctor's office and you're looking at Alnylam and some of these other drug companies, there are going to be kind of a criteria that has to happen before you would even be considered for genetic testing. So
Okay.
being like in our case, when I said to you, this is something that is 3 to 4% of the Black population, Black American population, West African. Okay, that's fine. But there's a big but that we haven't really got into yet. You have to be an adult to be tested. You more than likely probably have to have a first degree relative to be considered for testing, diagnosed, and now we're just needing confirmatory testing. So meaning there's some symptoms or some of the testing that has gone on that is warranting this type of testing, or your doctor's thinking that you're symptomatic enough and things are pointing to that. So it's not as simple as saying, okay, I'm Black, so I should have this.
Right.
And it would be it's for like TTR, basically a test that is done, and there's other phenotypes and things that go along with that. So I think a patient wouldn't necessarily have to worry about asking that type of test. And I think that's what a lot of people worry about is, I don't have all the right language. The most important thing is for a patient to accurately describe what is going on with them. So like when we talk about amyloidosis, for an example, or specifically V122I, one of the hallmarks of V122I, and I'm going to be very careful to say, just because you have this does not mean you have amyloidosis, but it can, is carpal tunnel syndrome. Okay, so carpal tunnel syndrome can just happen, as we know, because we all work on computers for 20 some odd years of life. And when my father had a carpal tunnel diagnosis, nobody thought anything of that because of that. But there's a lot of research out there that's saying that carpal tunnel, bilateral, especially, so both arms, is there's a link, and it's usually 10 to 15 years before you start having a cardiomyopathy. So if you're black and you start having these types of symptoms, that your hands, or this numbness and things like that, and you're saying to yourself, my grandmother passed away from heart disease, my grandfather was sick with this, I have a couple of aunts and uncles that are ill, or they're always talking about their nerves. That should be something that clues you in to not necessarily have the answers. And you don't want to go in the doctor's office and say, I have amyloidosis, and be an alarmist, because you may not. But you do want to say, hey, are these things, what should we consider when I have this as a medical history and a family history, and these are my symptoms? And then it's up to the doctor, it's up to the work that I do and other advocacy groups to make sure that that doctor is well informed to order the right test and give the appropriate follow up.
That makes sense. That makes sense. And I think the only thing that sort of gives me pause is sometimes, you know, this, we don't know our family history.
Hmm.
So I would hope, to your point, a physician would like really listen and like you said, investigate, because I would hate to say, well, does your mom or your dad have? I don't know. They don't know what they have. So I don't know what they
Exactly.
have, you know?
Exactly. And that's why I say to you, when we talk about awareness and education and things like that, why it has to be grassroots and grass tops, right? Because you all of us have holes in our medical history. And sometimes we have to. I'm talking to a lady right about that right now. She's saying, I don't really know anything about the paternal side of my family. And he's gone. He died for other reasons. My mom's still with me. I don't think she has a problem. But there's enough there that it's like, oh yeah, maybe we should look at that. And that's, to me, is on the part of a little bit onus on the doctor. It's the onus on the patient to say, let me just tell you what I know. Let me tell you what everything I know, and then hopefully you'll help me piece it together. And so, when I think, to your like original point, when you said, when a patient comes to you and says, I feel this, it's really important to listen to that.
And then let's talk about why, do we know why Black people are disproportionately affected?
Affected.
Yeah.
I think that is something that is still being researched as to why it's represented in 3 to 4% of the population, why we have this mutation. To be honest with you, it's not the only group. Like there's a Portuguese variant, Japanese variant, there's an Irish variant. But in the United States and America, actually globally, it is saying that folks of color are more affected West African descent, as in with many um, illnesses that affect Black folks. Sometimes when you say proportionally, what happens? We don't necessarily have the access. We don't necessarily have the earlier diagnosis. So, folks are possibly dying of things that we know nothing about. Um, So hopefully, with the onset of better medications and folks like what's happening at Amyloidosis Research Consortium and other support groups, that we can spread that knowledge so that, like, what I would say, like, those healthcare deserts are getting better access and there's more awareness there, so they can be treated before it becomes life threatening for them.
Yeah. And I'm also just thinking with what's going on maybe in the world or United States with DEI and black and
Mhm.
white and whatever, do you think funding is going to be cut? Do you think other things are going to
Oh, yeah.
this is not
I mean,
necessarily a priority for?
Right. I think across the board, when you look at, just yes. I mean, I think the short answer to that is yes. I think right now, definitely in the academic setting,
Mhm,
there can be fundings that are cut towards research
mhm,
that goes to that. And then I feel like when you look at rare disease is like a niche even within the larger spectrum of diseases, right? So you obviously you're very familiar with like cancer. Those are very well funded, right? And because more of a population is affected, so you will feel it, but you won't be the first. Whereas like rare, it will. So we're all impacted to a different degree, and I think this in the community we all feel and kind of just like, okay, let's watch and wait and hope for the best. I do still see, you know, a lot of great medications and things like that are in their approval process and moving forward. So hopefully those are still, going to be able to continue. But yeah, you can't not have these things not have um somewhat of hope.
yeah, yeah, I get that.
E-
And we
Exciting times, but also a little bit concerning.
right, right.
Mhm.
And we've talked about this offline, um,
Mm,
with talking about health and having maybe some of the information, but maybe not following up with a doctor, or and we've talked about even like equalizing it to a slavery mindset.
mm.
Can you talk to us about that? What is that
That
slavery
in this space.
in in regard to healthcare and having some type of information?
I mean, let's have a little back and forth about that. It's an interesting kind of debate because I think a lot of times we have the idea of we're just supposed to be strong, and strong means we don't need, and it's strong and private. So we don't need to go to the doctor. We don't necessarily trust the doctor. We have learned to be independent, resilient, and that is something that is rewarded um, to our detriment,
Yeah.
really. And I think that's one of the reasons why I'm out here. That it's good to be strong. It's relevant to our community. It's brought us to where we are. In a big however, it's okay to accept help um, because this will prolong your life. So not going to the doctor, right? Not ignoring that little pain where somebody could have said to you, you know what, I can fix that little pain and you're going to be okay for the next 20 years. Now you've come to me where I'm less able to help you and you have 5 months.
Mhm.
That's what you're looking at. And yeah, I'm not telling you anything you don't know. We hear a lot about, well, there's a mistrust uh, of the medical community. Um, with good reason, right? I mean, even for just what I just explained to you, what I just explained with good reason. But at the same time, I think we still have a responsibility to ourselves, our current generation, and our future generations to push past that, to set an example. When I look at my own self, I say, is it comfortable for me necessarily to talk to I mean, everybody in the world knows I'm a V122I carrier at this point. Is that the easiest thing? Not necessarily, because I don't always want to talk about it. But if that means that changes the life for my daughter and my son and their children, then there's value in that. And I think if people start looking and our community starts looking at it, that my health, especially when it comes to genetic conditions, isn't just my health, it's the health of your family. And maybe it's something to consider. And then the other part of that, I think this is just a little outside of slavery mindset, but when we talk about that trust issue, okay, again, and I know in this setting when we say, okay, we're going to work on underrepresented groups, we're going to be actionable, right? What does that actually mean?
Mm.
So when I in the setting that I always hear, it's like, oh, we're going to go into this church, we're going to create this program. Um, but what are we doing that actually shows long term benefit, right? Long-term access. So part of like my mission with my hashtag is the action is like, let me provide you, not with a solution necessarily, but let me empower you with information that you can understand in a culturally relevant way. So, and also garnering the strength of social media. Because I say this to everybody. Like a lot of times we talk to when we look at healthcare, and I even said it, this is a disease that a lot of times looks at people in their 50s and 60s, and how people in their 50s, 60s, 70s take in their information is very much different than how you and I take in information, and then say my daughter's generation. So you need to be able to appeal to all of those groups, and I think social media is the platform to do that. And then also looking at the facts, to what I said earlier, that when you talk about hereditary illness, it's a family issue, right? So okay, so maybe my daughter is on TikTok and she's 16 years old, and hereditary is not in her immediate future, but she's watching me, I don't know, dance around doing something goofy on the socials, and I'm talking about symptoms, and she says, "Oh, but my grandmother's been complaining about this. My father has said this. Well, I'm going to talk to her about this at the dinner table. Well, let me log into this and find out a little bit more about it." And that's to really help a community. You need to be in a community, right? And you have to provide them solutions in a way that they understand. And then because I've had a background in uh, regulatory for many years, I really feel the biggest thing, I think, even just looking at my father's and my journey, when you hear that you could possibly be sick, there's a loss of control. There's a loss of autonomy. You're afraid that your whole life is going to become a disease. The biggest thing is being people to be able to maintain autonomy. You want to be able, so I'm never going to be the one that's going to shake a finger at anybody and say, you have to be tested. What are you doing? Like, you can't do that. But will I be the person that says, hey, look, there's this ABCs of amyloidosis. These are the things that could be potentially going on with you. Now you can decide to go to your doctor's office and deal with it or not. And then hopefully, and in my mind, the way I look at it is if there is one person out there that benefits from that, dad didn't die in vain.
Yeah. And you spoke to this too, regarding it took several years for you to get tested, but you
Oh.
realized, you recognized that you were not in that right space yet. And I think that's powerful because you
Mhm.
have to be willing to receive information that's not the best. So I
Mhm.
think that's beautiful that you, not that you wanted that information, but you knew yourself enough to know, not right now, but I'll get to it.
That's right. And I think that's important for everybody to be able to have that. I remember, it's funny. You asked me before, like, what the roles you've had prior to being working in my hashtag, how did it shape you, right?
Mm,
So when to your point, working in regulatory and watching a and being a coordinator and watching people with illness and working around doctors, I remember a doctor saying to me, Erin, I don't understand why we're having trouble with getting people involved in this study, when we are basically renowned physicians that want to work on their illness and
mm,
it's for the greater good. And I remember looking at him at the time, and this is before I knew anything about V122 I or sick myself, and was purely looking at it from the perspective of these folks that were coming in to see me with potentially a hereditary condition. And I said, well, you say the greater good. I said, but the greater good is subjective.
mm.
If the greater good is I know something about myself that you're prepared to see me and observe me for, but you can't help me, is that my greater good? So I think that's what we have to keep in mind when we're helping people. is their autonomy to be able to decide what is the greater good for themselves. So to your point, it wouldn't have been the greater good for me to learn this about myself and carry that weight, um, not being able to do anything. But the reason why I'm out here right now and wanting to do something different is because I know people can actually have effective treatment now. They're not going to walk into a doctor's office necessarily and just be observed, or even if they're going to be observed, they know the second that they're, like me, and could possibly be symptomatic, somebody's there to actually help them. There is something that can be done. So the value to that knowledge is there.
Yeah.
I do think there's one important point, just because I try not to like touch on too much of the scientific discussion in all of this, but I think it's important to just to take a step back to the genetic testing piece. And another reason why, um, let's look at the Black community and we talk about sickle cell, and we do that. You do prenatal.
Mhm.
Uh, with sickle cell, you carry that. There's a strong likelihood the penetrance is there. You're gonna end up with the disease that's going to happen, right? There still needs to be research on what they call the penetrance
Mm.
of V122I. So, meaning, is it a complete penetrance? Is it incomplete? What me being a carrier, is it going to mean the exact same thing for it? Is it in terms of illness as it did to my father? Will it be worse? Will it be less? There's a lot of variation there. So when you have genetics that are variant that until they learn more could go either way, you have to be very careful in terms of how you test. So I think that's a very important point to make. Why? Because a lot of folks think, well, if it's 3 to 4% of the population, Erin, like, shouldn't, if you're a Black West African, shouldn't you just be tested? Not necessarily, at least not yet, and certainly not as an infant, right? So until they know more. So like if you look at, because folks have asked me, have you had your kids tested? My daughter's 16, my son is 9. And I said I was advised not to. I had met with the genetic counselor, and at this point in time, no. But the way I look at it is, my ear is to the ground with the research. If it ever becomes beneficial for them to know something earlier, they're going to know it and they'll get tested for it. Up until then, we'll probably wait until they're adults. They both have generalized awareness. They know how Papa died. They know Mom carries a gene and even gets worked up for it. So it has its time and place. So I think that's a very important thing to probably touch on, because I don't want to set the tone that, oh my gosh, I'm of this descent, I should have this test. It's a little bit more complicated. I think the biggest take home of this is, hey, I want to make sure that I understand this disease. This is something that is in my community. When there are people in my family presenting with certain kind of factors that, you know what, along with standard heart disease, this should also be on the table.
Yeah. And I think a big piece also is you have laid the blueprint for your children.
Mhm.
I think we've also talked about this. Like, you have some information that your children can bring to their doctors, which is huge.
Yes, and I think I'm glad you're bringing that up, because I think it's so easy for information to get lost. And I think what I'll share right now, this spans across just amyloidosis. I think it's a good idea for people to get in the habit of doing whatever their family history is in terms of medicine and health. Um, so when I started going to Boston Medical, as I told you, it was a 3-day evaluation. As you know, a lot. I'm in a digital world. My life is in a digital space. And of course, you all know we get a My Chart digital record, but I always ask for the hard copy record. Can you send me the hard copy record? And that's every year I get a hard copy record. And in my house, we have what's called the green binder. And the green binder basically starts with my dad. What, of course, we couldn't obtain all the record on dad. I don't have that. But what I do have is dad's genetic testing. That's the program for our family. But I will probably be the most complete history. So from the second I started, like, my genetics, so after dad's testing, then it's my testing, then it's every single thing that's happened to me from the time I started. So if I do become active, Nia, They're going to know what year it was, what date. They're going to be able to look at when Erin started first complaining of symptoms. It will never be lost. And I have actually told my family, even when they're not all ready to hear different things about this disease, but I said to them, I usually after every visit, I give them a little bit of like a 2 sentence text message of like, okay, guys, this year's visit went well. Staying on diffusional, pre-albumin's good. That's literally what I said this year. I said my record is going to be coming in a week, added to the green binder. Just remember, guys, if I'm no longer here, tell my kids look in the green binder and know it for yourself. Because I have nephews and other family members. It's relevant to my whole family, and I'm hoping that that continues. And I would encourage people, again, of course, we're talking heavily about hereditary amyloidosis, but any type of hereditary or significant family history of something, keep a record. You're saving a lot of headache and trouble for your family when you can. And we have that ability now. You know, we're back to that slavery mindset. We didn't have certain abilities before. And it's funny, I think back to our ancestors, and our ancestors would have said, you know what, we were denied education, but now you have education. Use it. You have the ability and resource to be able to document these things for yourself. We couldn't. I was at an exhibit in Boston. We weren't even allowed to, as slaves, to be able to write our name on anything. You can write your name anywhere now. Write it. Use what you're allowed to do to benefit you and the next generation.
That's deep. And I love how you're making that a standard. I think of the recipes that were saved. I think of, you know, generationally, it was in the big Bible. There were like, I think the
Oh yeah.
birth certificate and,
Yes.
my mom always saying the big Bible, God forbid something happened to me, X, Y, and Z. But in this green binder, it's the same exact thing. These,
Exactly right.
these are the things you need to look for, period. And I love how
And
you.
also, I think, Nia, with our generations, it's really getting around to the fact that, hey, we don't need to be embarrassed about our health with certain things. Like, yes, I understand you can still be a private person, but still give enough detail to be able to say, I know this is going to help my loved one. If I make this statement, like you kind of talked about breast cancer, like knowing like BRCA, like I'm like, oh, this is in my family, this happened, like knowing that will help you. So I'm going to tell you that. Do I need to tell you all the down and dirty, every detail of ever my visit? No, you don't have to. I guess if you don't want to, but it would help. And if people started like we talked about before, people started looking at my health is also my children's health. It's also my nieces and nephews' health. And maybe that we like move that needle a little bit.
Oh my gosh, you just speak to so many things because I think of just getting back to us talking. Like my
Mhm.
mom would say, my generation, we didn't talk about sex, we didn't talk about this, but she was like, if you would have talked to me about these things, maybe I wouldn't have gone through this, or maybe I wouldn't have to deal with this type of relationship, or maybe so just talking. And like you said, maybe you don't have to tell me every little detail that happened to you because maybe it's traumatic, but give me something to pass that baton so I can be better in whatever. I can.
And the person that comes after you doesn't have to start from the beginning. It doesn't have, like I said, especially when you're talking about chronic illnesses and things like that. Geez, it's scary enough. It is scary enough to sit in a waiting room not knowing what your fate is gonna be. Never mind not having any kind of knowledge to go along with it. I think about it like I come back to Dr. Burke again saying your father gave you a map, Erin. I stop and think about what that must have been like for dad to sit in that waiting room, even as a 60-something-year-old man. All of a sudden, oh my gosh, I've always relied on my body. I've been a healthy guy. I'm an athlete. I can't move. I don't know what this means. And now somebody's telling me you have a hereditary condition. And all I can think of is maybe I had a great uncle and a grandfather that, it was the big one and they died and that was that. And now you look back on this and those people probably had amyloidosis. And we'll never know. My father was one of 13. I think there's 6 left. And I will never know. It, just by what I told you, simple science, right? Autosomal dominant, 50% likelihood. 13 kids my grandmother had. It's really unlikely that my father was the only one that carried that trait, but I'll never know.
Mm. Wow.
And I think I actually met a woman not that long ago. She also came from a large family and she's a hereditary carrier and she's lost so many of her family members. One issue I think for her is she was very delayed in getting her ability to get a diagnosis.
Mm.
And then also there was other issues of folks just different time points coming to the table and benign systems, symptoms and becoming ill. And I just look at it. There's so many in our families in our community that can be spared that kind of pain. If we just communicate,
Yeah.
just talk.
And just talking, we get out of that slavery mindset of
I have to be strong. Strength and resilience means silence.
mm,
No, strength and resilience can also mean death
mm,
if you in poorer outcomes. And I don't mean just in amyloidosis, I mean in general. If we don't talk, if we keep all of our pain to ourselves, we could lose our lives when we didn't have to.
where can people find you? Because what in the world?
Well, well, I so that anybody looks up hashtag HATTR next gen, Erin Poyant, you're gonna find me. I am on LinkedIn, TikTok, Insta, Facebook. You just typing away. Yep. And then of course I didn't really get in. We talked most today about my hashtag, but there might be folks in your audience that are already kind of aware and need help or looking for a resource. I want to also mention Amyloidosis Research Consortium. I want to mention ARC because they have a lot of great educational materials. If you're on my LinkedIn, you're going to see that posted quite a bit. I kind of plug their resources, and they also my colleague. If I'm doing I do like healthcare provider engagement. My colleague with a social work background does a lot of one-on-one um, engagement with folks that might be pre-diagnosed, might be in a diagnosis. And so helping, and this is national and global, to be able to help them in the process and the journey. So I think, geez, yeah, when you look at it in this, dad's been gone 5 years.
Mm,
What has happened in that time that, I actually had a friend just yesterday say to me, Erin, and she doesn't even work in the space at all. She says, Erin, I just saw an ad on TV and it was about amyloidosis. And then I'm telling you about my colleague that's speaking to people regularly and taking all these calls. It's changing. It's changing, and we all can do our part in that uh, for the next generation.
mm. And just quickly, I just want to speak to this because how do you feel knowing that it's changing in a positive direction? Does it make you say, like, why couldn't that happen for my father?
Yep. It depends on the day, Nia. There are days I watch my son play football and he plays just like his papa, and I say, "This isn't fair." Dad was, I've met gentlemen that were diagnosed in 2016 that are still alive today, but because my dad was diagnosed in 2014, I had to lose him, and he didn't get to see his grandson play ball because I'm a human, and it hurts. But there's the other part of me, like I think it's a spiritual part of me that just says this is the time. God called him home. This is what it is. And he would want us to carry on. Dad used to always say, it's funny, my sister reminded me of this a month ago because of the project I'm working on. And I said, guys, when you think of Dad, what did Dad always say? And my baby sister said, he'd say, keep on keeping on. And keep on keeping on in warrior's blood. That was two things Dad said all the time. And so I think when I get in that space, where I'm feeling a little sad or like it's not fair, I also say, Dad would have said, keep on keeping on. And I am, to my last breath, I'm going to do right by my dad in every decision I make to make sure things are different for other people.
I think you have a lot of life in you, but I can say in this time, you've certainly made it proud.
I really hope so. And I think that helps me with that grief process. If you can turn something tragic, and if you can turn grief into purpose and impact, it kind of heals your soul a little bit.
Yeah. And ending with this, as this is the Humanitarian Heartbeat podcast, is there anything else on your heart that you just want to share, the take-home message, if someone didn't hear anything else?
I think, well, there's a couple of things. I think the biggest thing I want to say is there is no voice that is too small to make a difference. Fight for yourself and fight for the future of your legacy.
We're going to end it on that. Thank you for all your work that you're doing. Daddy's proud.
I really hope so. I try. Thank you for having me, Nia.
Thank you for sharing your story and Dad's story.
Appreciate it.
God bless.
Thank you for joining us on the Humanitarian Heartbeat podcast. Remember, each conversation brings us closer to a world where compassion thrives. Stay connected, stay informed, and let's keep the heartbeat of humanity alive. Subscribe, share, and be a part of our journey to make a difference, one conversation at a time. Until next time, keep your hearts open, your minds curious, be a blessing to others, and give agape love. God bless.